Have you ever stared at a denied medical claim and just felt completely stuck? Well, you're in the right place. Today, we're going to put on our detective hats because we're turning those frustrating denials into a puzzle that you can actually solve. Let's open the case file.
You know, when a claim gets denied, it is so easy to see it as just a dead end, a roadblock. But what if we looked at it differently? What if every denial wasn't a failure, but a new case that just landed on your desk? It's a puzzle full of clues and suspects, and there's always a path to resolution. You just have to know where to look. So, here's our game plan for today. First, we'll look at the case itself. Then we'll assemble our investigation kit. After that, we'll profile the usual suspects behind these denials, map out how to actually solve the case, and finally, learn how to close it out for good. Think of this as your official playbook for cracking any denial. Okay, let's be real for a second. A denied claim isn't just some small annoyance. It's a direct hit to a practice's revenue cycle. And these things happen all the time for all sorts of reasons. That's why getting a handle on denial management isn't just, a nice skill to have. It's absolutely crucial for keeping a practice financially healthy. And this right here, this is the #1 rule of the game. There is no magic, one-size-fits-all solution. Every single denial is its own unique case file. It needs its own investigation and its own careful, detailed approach. If you forget this, you're just going to be chasing your tail forever. Any good detective will tell you, you don't just rush into an interrogation, right? You prepare, you gather your evidence. And in our world, that means getting all your facts straight before you even think about picking up the phone to call an insurance company. Trust me, this one step will save you more time and headaches than anything else. So, what's in this investigation kit? Well, it all starts with the basics. First, you need the provider info, especially that tax ID. Second, get your patient vitals down: ID, name, date of birth. Third, the claim specifics: how much was billed and what were the dates of service. And finally, #4, check the case history. See what's been tried before. Having all this ready puts you in complete control of the conversation from the get-go. All right, we're prepped and ready to go. Now it's time to profile our suspects. While it feels like there are a million reasons a claim can get denied, they almost always fall into just a few common categories. Learning to spot these patterns, it's kind of like a criminal profiler understanding their targets. It helps you predict what's next and figure out the right way to respond. And this is one of the best tools in your entire arsenal. The denial cheat sheet. This isn't just a list of codes. Oh no, it's your script. It literally gives you the exact questions to ask for every type of denial, whether it's coverage terminated or claim not on file. It makes sure you don't miss a single clue. It's your secret weapon. So let's look at these main suspect profiles. First up, we've got identity and eligibility errors. Think of it as a case of mistaken identity or an expired policy. Second, you've got your clerical and filing errors. These are simple process mistakes, like lost paperwork or filing too late. And third, there's authorization and justification errors. This is when a procedure wasn't pre-approved or maybe wasn't considered medically necessary. I promise you, almost every denial you ever see will fit into one of these buckets. Okay, with our case prepped and our suspect profiled, it's time for the interrogation. This is where we start taking action. So let's walk through a few classic cases and I'll show you the exact steps to solve them. Our first case is a classic, the duplicate claim, denial code CO-18. Now, on the surface, it seems simple enough, right? The insurance company is saying you billed them for the same service twice. But a good detective knows that the initial report, well, it isn't always the whole story. The real question is, was it truly a duplicate? And here's the plot twist. If it was a simple clerical error, a true duplicate, you just write off the extra charge. Easy. Case closed. But what if that same service was legitimately performed twice? That's not a duplicate, that's a repeat procedure. The key is to rebill it, but with the correct modifier. You'll use modifier 76 if it was the same provider, or 77 if it was a different one. That tiny little detail, it changes everything. Next up, one of the most common and honestly one of the most frustrating cases you'll face: no authorization, or CO-197. The insurer is claiming you never got pre-approval for a service. And yeah, this one can feel like you've just hit a brick wall, but there are actually a few secret passages around it if you know the map. So here's your investigative path. First, just check your own system. Is there an auth number hiding in there? If not, check the place of service code. If that code is 23, which means the emergency room, Pre-auth often isn't even required. You can just ask the rep to reprocess it. And if it's POS 21 for an in-hospital patient, you can often just use the authorization number that was already approved for the hospital's claim. See, it's all about logical steps that get results. All right, time for a little pop quiz. You get a denial for CO22, covered by another payer. The insurance company is basically pointing the finger somewhere else. So what's your first move? What do you do? The answer isn't guesswork. It's just simple logic. Your first move is always to verify eligibility. And this table lays it out perfectly. It's an if this, then that situation. If your check shows that the denying insurance is in fact the primary, well, you get back on the phone, you present your evidence, and you tell them to reprocess it. But if your check shows that another insurance is primary, you just update your records and bill the right company. No drama, just facts. So as we start to bring our investigation to a close, let's just recap the biggest takeaway here. When you follow these steps, you're not just a biller anymore. You're a true revenue cycle investigator. You're not just reacting to denials, you're proactively solving them. It really all boils down to this simple 3-step method. First, prepare. Get all your evidence together before you do anything else. Second, identify. Profile the denial so you know exactly what you're dealing with. And third, act. Follow the clear, logical steps for that specific profile to find the solution. Prepare, identify, act. That's the whole method right there. And finally, the mark of every true professional. This quote says it all. Just like a great detective, you have to keep meticulous case notes. Every call you make, every piece of info you get, every action you take, document it. This creates a paper trail that protects you and makes every future step way more effective. This part is non-negotiable. So we've laid out the framework, the tools, and the methods. You now have what it takes to look at that stack of denials, not with dread, but with a real sense of purpose. You're not a victim of the system anymore, you're the detective who knows how to make it work. So the only question left is, which case are you going to solve first?